Today, Amanda, Lori, and I are going to discuss the case of 4-year-old Arturo Rodriguez. We'll review diagnostic criteria for acute stress disorder, PTSD, unspecified trauma and stressor related disorder. We'll discuss some special and cultural considerations pertaining to Arturo's case. And finally, we will collaborate on the course of Arturo's illness. Arturo is a 4-year-old Hispanic male, lives with his mother, Elena. Elena has sought some services for Arturo as he's been acting differently after he witnessed a traumatic event in which his father was detained by police and his home was destroyed. Some of the symptoms that Arturo is displaying, he is afraid of strangers. He's very clingy with mom. He's having nightmares, difficulty falling asleep, very fearful of law enforcement, so much so that he goes into severe distress. Mom states that when somebody knocks at the door, he jumps out of his skin. He's hiding in the closet often. He's pretending that normal everyday items are lost. He's turned it into a game with his babysitter, Nadia. He is reenacting the events of the night his father was detained by law enforcement through play. He's become less affectionate with his babysitter, Nadia. And finally, he has reverted to wearing diapers again.
All right, so the first possible diagnosis we're going to talk about is acute stress disorder. So Arturo does meet some of the diagnostic criteria for acute stress disorder, such as criteria A, as he directly experienced a traumatic event as his father was removed from their law enforcement and detained. He also displays 8 of the required 9 symptoms from criteria B, including negative mood, intrusive symptoms, avoidance, and arousal symptoms. Per the DSM and criteria C, the onset of symptoms with acute stress disorder occur anywhere from 3 to 30 days after the trauma. Unfortunately, we don't have a timeline, so we don't know exactly when Arturo's symptoms began and how long this has been going on. We can confidently say that his symptoms are clinically significant and are not attributable to another medical condition or substance as outlined in criteria D and E. So the next possible diagnosis is post-traumatic stress disorder in children under 6. So again, Arturo does meet some of the diagnostic criteria for PTSD as he directly experienced a traumatic event of father being detained per criteria A. Arturo also displays multiple symptoms consistent with criteria B's and symptoms and consistent with criteria C's avoidance of stimuli that remind him of the traumatic event, as well as multiple negative alterations in cognitions. He's also experiencing alterations in arousal and reactivity. However, criteria E states that the symptoms must persist for more than 1 month. And again, we don't have enough information to confidently say that, he does have PTSD because his symptoms have been going on for more than 30 days. We are confident in saying that his symptoms are clinically significant and are not attributable to another medical condition as outlined in criteria F and G.
So our provisional diagnosis is unspecified trauma and stressor-related disorder. According to the DSM-5 published on the American Psychiatric Association's website, unspecified trauma and stressor-related disorder applies to presentations in which symptoms characteristic of trauma and stressor-related disorder that cause clinically significant distress or impairment in social, occupational, or other important areas of functioning predominate but do not meet the full criteria for any of the disorders in the trauma and stressor-related disorders diagnostic class. The unspecified trauma and stressor-related disorder category is used in situations in which the clinician chooses not to specify the reason that the criteria are not met for a specific trauma and stressor-related disorder, and includes presentations in which there is insufficient information to make a more specific diagnosis. So as Amanda was discussing when she reviewed acute stress disorder and PTSD, Arturo does meet a lot of the criteria for both of those diagnoses. However, we do not have a timeline from the day that Arturo witnessed the traumatic event to when he started displaying the symptoms to when mom brought Arturo into the clinic for services. So we believe that unspecified trauma and stress related disorder is going to be the most ethical and least restrictive diagnosis for Arturo. Some special considerations specific for Arturo because he is the child of Hispanic immigrants. In a longitudinal study conducted by Perea and Ornelas in 2013, 61% of Hispanic male immigrants report that they have been through at least one potentially traumatic event in their life. Same category except women, 51% report the same thing. And then 68% of children report a potentially traumatic event by the age of 16 years old. When providing services to Arturo, it's important to take the following into consideration. So it states in the case study that the clinic that Elena was referred to is a bilingual clinic. So if Arturo does not speak English, or maybe his dominant language is Spanish, they'll need to provide services in Spanish. There needs to be some ethnic similarities between Arturo and the provider. If the provider uses metaphors or any sort of comparison, they need to be culturally relevant. And then the provider needs to try and incorporate as many of the cultural values and customs as possible. Some of the main components of the intervention, again, needs to respect Arturo's culture. When developing the treatment plan, make sure that you're using methods and techniques that again align with Arturo's culture, and then goals need to be tied to the cultural meanings and presenting problems, and finally the context of the situation, so social, economic circumstances during treatment, including acculturation, migration phase, and poverty. So again, we're not sure if Arturo migrated with mom and dad, but we do know for sure that he is the child of a father who migrated from Mexico. And then the course of Arturo's illness, through collaboration, Amanda, Lori, and I have determined that, and with research, studies have found that the development of PTSD is strongly associated with the acute stress disorder. Nearly 50 to 90% of people experiencing trauma during their life experience trauma during their life, yet do not develop trauma-related disorders. Those with more severe symptoms early on are at a higher risk for PTSD. Trauma-focused CBT is the first line of treatment and has been shown to reduce the risk of subsequently developing PTSD. The treatment can be delivered in person or online. Most individuals that develop PTSD recover within a few years. However, a third of patients still have symptoms after over 2 years. Some racial ethnic minorities are more likely to put off getting treatment for PTSD, and delays in therapy may result in worse clinical outcomes. Treatment course for Arturo would be trauma-focused cognitive behavioral therapy, which aims to meet the needs of children and adolescents with PTSD, stress, or other issues associated with traumatic life events. It is an evidence-based form of psychotherapy. The plan would be to meet twice weekly for 12 weeks, 1 hour each time. And we determined this through a number of international research that compare evidence-based therapies for trauma across cultures, contexts, and experiences. Thank you for listening.